Regarding the eye signs of a patient with thyroid dysfunction, or if we would like to check the eye signs in patient with suspected thyroid disease, in the following way really the examination is conducted. First of all, sit in front of the patient and to see his eyes, especially the eyelids with the cornea. As we see here, okay. As we see here, the lower eyelid is just at the inferior limbus, at the inferior border of the cornea, while the upper eyelid midway between the pupil and upper border of the cornea, which is the normal. Patient with lid retraction, the upper eyelid will be elevated and the sclera will be visible from above, while a patient with exophthalmos may have either visible sclera below or the sclera will be visible from above and below. This is the eye sign from the front. After that, we have to check for a proptosis from the side, which is a protrusion of the eyeball for both eyes, and then we have to check whether the patient had lid lag or not by asking the patient to follow the finger or a pen several times after stabilization of the head. حماد هسه بدون ما تحرك لنا راسك بعينك تباوع للصبعي راح يصعد وينزل. Okay, several times slowly to see any lid lag. If the patient had lid lag, the following will happen. For example, in this eye, this eyelid will lag behind. This is what we call it, lid lag. After that, we have to check for the also proptosis and that accompany exophthalmos from behind the patient. And I'll see really from above superciliary ridges from here till the cheek of the patient. There must be no protrusion of the eye. Any interference from the eyeball in this plane of vision indicate a proptosis. After that, let's return back from the front and to see the eye again. First of all, I'll ask the patient to bend his head down. تنزل راسك هيك ترفع عيونك لفوق هيك تباوع لفوق to see for the wrinkles. Absence of wrinkles indicate exophthalmos here. هسه على راحتك. After that, I'll check the following. ورا اصبعي بابا لهنا. I'll check for any conjunctival or watering of the eye, conjunctival congestion, corneal ulceration. This is due to overexposure of the cornea and conjunctiva because of inability to close the eyes in patient with exophthalmos. Also, the contralateral side should be checked. Okay, عشتيدك. After that, we have to determine roughly the pressure in both eyes. بس غمض عيونك to check just the pressure in both eyes. عشتيدك. After that, we have to perform the H test and asking for any diplopia and to see any limitation or any nystagmus. تتابع لنا اصبعي وين ما يروح. شوف لنا اياه واي مكان تصير به الصورة اثنين تقول لنا بيها. Okay, ماكو مكان حسيت بالصورة اثنين اشتدك. And we have to see the nystagmus on any limitation in movement which was absent. After that, we have to determine the near accommodation reflex. هسه تباوع لنا اللي قدام على مثلا الزاوية مال الحائط. هسه تباوع لنا على القلم مالتي. Okay, to see the convergence, the ptosis and meiosis. Patient with exophthalmos اشتدك. Patient with exophthalmos had limitation in the convergence. All these really are the signs of or eye sign in patient with thyroid dysfunction.